It's exciting to be here with all of you today, the Miami Rotary Club. You look great for 105 years old. It was my pleasure to be with you at your presidential installation, and so nice to see familiar faces here. Well, I'm delighted to be here today to share with you a little bit about the organ transplantation program at the Miami Transplant Institute. And it is our nation's largest transplant program, and it lives right here in our own backyard. And it's a well-kept secret. People come from all over the country and all over the world to seek care here for organ transplantation. A fun fact I'll share as I get started. My husband is a retired NYPD detective, and he served with Chief Timoney, Noreen's late husband, Chief John Timoney, who also served as First Deputy Commissioner. He was a well-respected leader in the New York City Police Department, as well as Miami and Philadelphia, and he left an amazing legacy behind him. So much to be proud of, Noreen, and we are thankful for his service. And a shout out today to all of our veterans. We thank you for your service as the child of a 27-year merchant Marine and as a recent participant with Honor Flight. It's a joy to honor and remember our veterans. Well, let's talk a little bit about organ transplant and what we can share with others and how we can help save lives along the way. So I do serve as one of the directors at the Miami Transplant Institute with Patient Access and Revenue Cycle, and I work directly with the University of Miami's 62 transplant surgeons and physicians. It's an incredible team that gathers together to care for all the special needs of our transplant patients. I've been with the medical school for 23 years and 17 years with organ transplant, and we have grown over that time to be the largest in the country. All of our transplant surgeries take place on our campus here at Jackson Memorial Hospital, where our institute building is located right across the street from Ryder Trauma. And what I'm going to share with you now is an incredible fact that no other center in the nation has performed more transplants than our institute in any individual year. And it also has the record amount of kidneys ever performed in this country. The Miami Transplant Institute is in its 51st year of partnership between Jackson Memorial Hospital and UHealth, the University of Miami Physician Group. Now, Dr. James Jackson, the first president of your Rotary Club of Miami, upon his passing in 1926, the community recognized Dr. Jackson for his many outstanding contributions, and they named the only hospital in town, Jackson Memorial Hospital, in his honor. So another very important fact to be very proud of here at the Miami Rotary Club. And if you ever get a chance to visit the UM Jackson complex, there's a small building in the center of the incredible complex down there, and that tiny historically preserved building is called the Alamo. And that original building has a tiny OR and a tiny pharmacy and clinic room and an old x-ray machine and some great photos on the wall. So when you go by, stop and take a peek. At our site, the Miami Transplant Institute has performed up to 747 surgeries in a single year, and those are just the transplants. We do every organ transplant that there is, and we take on the most complicated cases around the country and even internationally. We do heart, lung, kidney, pancreas, liver, intestine, and multi-organs. Also, living-related kidney donors and a myriad of other organ care surgeries and procedures like intestinal rehabilitation and life-saving support for heart and lungs with VADs, ventricular assist devices, and procedures called ECMOs, which is a short-term therapy to help support the heart and lungs when you are in need. This program did not skip a beat during the pandemic. You cannot ask someone in liver failure or heart failure to just hold on for another few months until things get better. It's just not an elective process. We even produced a documentary called Transplanting Through a Pandemic. If you'd like to take a look at that online, it is fascinating. So what happens as part of the transplant process? Well, you get referred by a physician to a transplant hospital, and there you undergo a transplant evaluation. There's multiple phases in the process. That determines if you truly need a transplant and if you medically qualify. Referrals sometimes can happen early, sometimes they can happen too late, and someone may be too sick for transplant. So you undergo testing and various physician consults and lab work, biopsies, EKGs, your annual testing like colonoscopies if they are not up to date, to see if you could physically sustain an organ transplant if needed. If you qualify and you are truly in irreversible organ failure, you then get placed on a wait list nationwide. Very important, you need to know this in case a loved one is ever in this situation. You can be listed on more than one transplant center's list. It's one overall national list, but there are different lists at different centers. The wait list is a national list of candidates who are registered to receive the transplants that qualify. And when a donor organ becomes available, this matching system generates a specific list of potential recipients based on the criteria of that organ donor and the organs in that allocation process. So some depend upon geographical location, that is a factor. Some depend upon your different metabolic states, your size, your weight, your blood type, and depends upon the severity and how long you may have been waiting. So wait times for transplant, they vary, and not everyone, as we know, who needs a transplant will have that opportunity. There is quite a shortage. Waiting time is a more important factor for some organs, such as a kidney and a pancreas, and is less of a factor for heart and livers and intestines that are more time sensitive and depends upon the severity of the patient's needs. So using a combination of donor and candidate information, UNOS composes a system-generated match run, a rank order list of candidates that get offered for each organ. And it is unique, again, to each donor and each recipient. The candidates who appear the highest on the rank are in the most urgent need. We take the most complex patients, again, from around the country and from around the world. And so we have quite an extensive match run list. We currently do about 25 pediatric and adult heart and lung transplants, 200 in our history. Organ failure can come from COPD, or chronic obstructive pulmonary disease, pulmonary fibrosis, and cystic fibrosis, which we've all heard of. Some of you may have heard of the Venezuelan singer Jose Luis Rodriguez, El Puma. Anyone heard of El Puma here? A few have, okay. Well, he received a double lung transplant at the Miami Transplant Institute. And he was able to recover and breathe and sing, and was doing wonderfully post-transplant. And it was amazing to see him down at the campus and to share the joy with all of his fans around the world.
He's in great shape. I just saw him last week.
Oh, okay, wonderful. He's in great shape. Oh, really? Look at that. He was seen just last week and had no idea he had a transplant. Fantastic. Well, over 50,000 people nationwide are waiting for a heart at this time. We do over 500 kidneys a year, and here in Miami we've done 6,500 since 1988. We've done over 4,000 liver transplants, about 150 a year, including 25 in children. 50 transplants of kidneys, and I was actually able to be part of a procurement from a donor for a liver into a recipient of a mother of 5 beautiful young children who I happen to know. And I share her story because she was in denial that she had anything going on. And she had severe itching at her extremities, at her hands, at her feet, severe itching. She wasn't feeling good. She wound up in the emergency room. I had seen her because she's a friend of the family. I went down and I asked one of our hepatologists to come down and take a look. And so when the liver is in failure, it's amazing what the body does. It was pushing the toxins to her extremities, to her hands, to her feet, and the itching was the body's natural option to try to remove those toxins through the scratching. And she was in liver failure. And she did move forward with the process, and she wound up having a liver transplant. And she is happy and wonderful and spent time in Disney with her children. And I got to see that procurement from another young lady that went to her. And one of the things she asked after the transplant was, did my liver look bad? And I tell you, it was about the color of this podium here. And she received a beautiful pink liver and is doing just wonderful. So, so many great stories. So in order to do transplant, there needs to be a donor. Now I know you're saying, okay, here it comes. She's going to ask for my kidney today. No, I'm not going to ask for a kidney. So relax, let go of your side. I saw Renell in the back. He grabbed himself there. I said, no, I'm not coming for the kidney. I'm not collecting donor cards or recruiting volunteers. But I will let you know, as of 7 a.m. today, there are 862,000 men, women, and children on the organ transplant waiting list. Every 9 minutes, another person is added to that list. And every 17 people pass each day while waiting on that list. Each donor can save 8 lives and up to 72 more with tissue, eye, and bone donation. So we know there's not enough organs from donors, but I will tell you another option that we have. And I'm going to need a couple of volunteers here. Miss Noreen, let's say Miss Noreen needs a kidney. Living-related donation is a possibility. Instead of waiting 5 years and on dialysis, who in this room would give Miss Noreen a kidney? I know. Okay, you're operating the technical. Shirley Parton, come on up.
Oh, what a coincidence.
So, you are going to be our recipient 1. And Miss Shirley, would you stand next to Miss Noreen? You are going to be the donor.
It's about time.
Now tell me again. Eileen, she needs a kidney. Now, who would give Miss Eileen a kidney today in the room? Oh, another one. Renell, come on up. You were always going to give Miss Eileen a kidney. So, you are going to be our recipient, and Renell, you're going to be our donor. And fantastic, isn't he great? And tell me your name, sir. Again, Brian. Now we know this is not happening, but Brian might need a kidney. He's going to be our recipient number 3. And who is going to give Brian a kidney today in this room? Thank you. Come on up, Eileen. It's Eileen, right? Marsha, she's going to be our donor. Now, isn't this special? The act of living-related donation and the fact that there's just not enough organs on the list. So we have living-related donors. We have up to 3 ORs that are available a week to do this. Now, Shirley really wants to give to her sister Noreen, but they're just not a match. Different blood types.
Never mind.
Now here, recipient number 2 and donor number 2, they are not a body size match. His kidney is a little larger and it won't fit into the space that our recipient number 2 needs. And Brian is just not a match with Marsha. And so what happens? We're going to ask everybody, would you be willing to donate, or would you be willing to receive a kidney from someone other than your donor if they were able to offer it to someone else? Would you receive a stranger's kidney?
Yes.
Yes. And would you receive a stranger's kidney as well? To get one, and you would as well. Fantastic. Now all of our donors, your recipient would love to take your kidney, but you're not a match. Would you donate to someone else so that she could get a match? No. She said yes, absolutely, without question. So it turns out that our donor number 1 is a match for our recipient number 2. So you come and stand right over here. Now we know that our donor number 2 is a match for recipient number 3. So stand right over there. And donor number 3, well, look at that. She is a match for recipient number 1. So this is called a paired exchange. So we're all going to head to the OR at the very same time. Everyone, all of our donors are going to start the donation process, and they're going to move forward to the recipients. So 6 ORs are going to go on at the same time, and we're going to remove kidneys, and we're going to pass them on. And look what we've done. There were no organs that were available on the donor list, and we were able to do something called a paired exchange, and we have done this up to 4 ways at University of Miami-Jackson Memorial Hospital, so 8 different people were either had lives touched during this process. 4 recipients with 4 donors. So thank you all for your gift of service and for donating kidneys today. And we're so glad everyone is doing healthy and well after that. Okay, so what's new in the transplant world? On Friday, August 27th, MTI, Multidisciplinary Team, led by our chief, Rodrigo Viana, performed the first successful living kidney donor transplant via the Da Vinci surgical system. This was robotic surgery, which is expected to lessen the hospital stays to 24 hours or even less as a donor. Absolutely amazing. The robotic surgery is going to minimize surgical complications for the living donors and patients and other types of procedures in the future. Lessens medical risks, including exposure to diseases such as COVID, which is potential in a hospital setting, and to safeguard our kidney donors now and into the future. So with the robot, physicians have a complete 3D view and accessibility to maneuver around organs, tissue, vessels, without having to mobilize and move as much. There are 3 ports that are placed along with 1 lower pelvic incision to extract the kidney from the donor. So there's reduced pain, it's less invasive, less scarring, a quicker recovery, and a shorter hospital stay. So that is currently happening at our institute. Also, cutting edge, what else is going on? Xenotransplantation. What is that? Xeno is a Greek word. Does anyone know what that's Greek for? Foreign. So for years we have heard about valves from pigs being used in heart valve replacement surgeries, even cow heart valves, and many of us know people who have had a surgery including that. There are studies going on for the use of possible foreign kidneys for transplantation. So that is being studied, and it is out there, so something to think about. There are immunological barriers that are being explored, so there's more to come, but lots of research happening for that. I'd like to share a quick little story about a donor and a recipient. Actually, I'm going to share one that's not on here. Father of a beautiful young girl. Her name was Abby, a story that was on our news a couple of years ago. She was 20 years old, and when she was in Mexico, regrettably, she was on a trip with college, and she drowned. And her father decided to donate her organs, and he wanted to do something special. So he decided he was going to ride his bike. I want to say it was I believe it was from Michigan. Ride his bike across the country, all the way to Louisiana, where the recipient lived, and he had a stethoscope he carried with him. And he was able to hear the heart of his daughter beating inside of this young man who received it. Fabulous young man. He continued his journey on his bicycle. Dad did all the way down here to Fort Lauderdale, and I was actually there when he had arrived, and once again was able to embrace the young man who had his daughter's heart and listen to it. And along the way, he decided he was going to make something positive happen. Over 2,000 people signed up to be organ donors and heard his story as he traveled across the country. So what a difference one person can make. There are so many wonderful, amazing stories out there. I'll ask you a couple of quick questions before I close up. I am out of time. What is the age cutoff to be an organ donor? 70? None? Okay, there is none. We have transplanted into the 80s. Please don't self-diagnose and say, I am too old, or I am too sick, or I am what have you to be an organ donor. Please consider it if you are not. You have an option to sign up at the Driver's License Bureau. You can sign up online. Most important, please talk to your next of kin so that they will know that it is your wishes should something happen.